One of the things you have to do from the get-go is not be bashful. Um, in the army scenario, I like to use a formula called ACE. Your ACE card, the ACE up your sleeve, and what does that stand for? It stands, first of all, A stands for ask. Um, we think, boy, if I ask that question and they're not in that place, will I put them in that place or give them ideas? And that's not the case. What we need to do is we need to be bold enough to say, hey, I care about you, and I just want to make sure you're safe. And so I'm not trying to insinuate anything, but I'm just going to ask you very directly: do you have thoughts of self harm? Are you in a place where you're struggling with these things? Are you losing hope? And that's a tough question to ask, but it's a very important question to ask. And so as you deal with people, if you see somebody that anything you wonder, just bring it up. Just say, "Hey, because I care about you and because I want to make sure you're safe, I'm just gonna be direct here." And if they're like, "Oh no, I'm good," then take them at their word. Don't probe or dig. Let them bring it up when they're ready to. But at least what you've said to them is, "I care about you," and that's what the C stands for in the ACE model, is care. Don't be so focused on your world and your agenda um, that you can't stop and see somebody in need and come to their aid. And this is something that anybody can do. You don't need grief counseling training. You don't need to have um, a degree in psychology or anything to care for somebody and do an intervention. In fact, a lot of what we see in the interventions that are successful happen from what we would call in the army the battle buddy level, the side to side, a friend seeing another friend in need and just caring. And then that's the E in ACE, stands for engagement. Engage with them, help them, direct them to resources, and be with them through the process. It doesn't matter. It could be a bit inconveniencing at times, but we're talking about someone's life. We're talking about somebody who at that point really really needs us more than anything else. And so allow yourself to be inconvenienced and engage with um, the individual, and until you can pass them off to someone who's maybe a little more licensed or has the resources to really get them that deeper help that they probably need at that point. And so that's really kind of in a nutshell how I would recommend somebody would approach that. Parents can do it with their kids. Teenagers these days, sometimes they're going through things, so it can be used in any environment. But it's kind of what I use that works well in the military setting.